The Arie Nasal Mask by Sleepnet is designed to provide optimal respiratory support for home care and CPAP patients. Ensure you have the Arie Nasal Mask, tubing, headgear, and any necessary ventilation equipment. Wash your hands thoroughly and ensure the mask and components are clean and ready for use. To assemble the mask, insert the top of the tube into the hole at the front of the mask frame. Next, insert the mask frame into the mask cushion from the bottom to the top. Snap the frame into the mask by pushing both together. Run your fingers along the connection to ensure the frame is flush with the mask cushion. Connect the headgear clips to the mask frame by hooking the clips to the frame bars on the sides of the mask. Ensure the clips snap in securely. If you are a first-time user, start by putting on the mask in front of a mirror. Detach one headgear clip from the frame. Slip the headgear over your head, then reattach the headgear clip. Place the mask in the correct position on your face, with the bottom of the mask cushion sealed just above your upper lip. The top of the cushion should rest on the bridge of your nose. Tighten the top and bottom straps on both sides of the headgear so that the mask creates a snug seal on your face. Continue adjusting the mask until you achieve a comfortable seal. Ensure the headgear is flat across the back of the head. To ensure a proper fit, avoid over-tightening the mask. The Just Fit headgear gently positions the mask without over-tightening, allowing the soft silicone cushion to rest lightly on the face. Once adjustments have been made, connect the mask to the ventilator tubing